The Public Health Department says it is not too late to get a flu shot. This year's flu season is just getting underway. Derek Conlon joins us now. Well, Derek, doctors have had a busy season treating people with other respiratory problems so far.
They certainly have, Brian. Respiratory syncytial virus, or RSV, is just one of those viruses that's been going around since the fall. It's been keeping doctors very busy. In fact, a lot of people thought they had the flu late last year because RSV shares some of the same symptoms as the flu. But the numbers of RSV cases are now on the decline, which means doctors are now getting ready for the next big health concern, and that is the real flu season. Dr. Benjamin Burko has seen his share of unhappy patients this season. At his tiny Tots medical clinic in DDO, there haven't been more cases of respiratory syncytial virus, but the effects have been tougher on his little patients.
The viruses are bad enough. They cause miserable fevers and runny noses and coughs, but the complications are really what get you down, and those include pneumonias, and we've been seeing lots of pneumonia.
But now that the number of RSV cases is starting to drop, healthcare workers are preparing for the next public health concern, the flu.
It's a disease that's very important in terms of morbidity, how sick people get, and its complications. And we think in Quebec, we estimate that each year up to 1,500 people die from complications of influenza.
Despite the fact that 500,000 people in the Montreal area will get a flu shot, 1 in 6 people will still develop the flu. The people who are most at risk include the elderly, the very young, people with chronic diseases, and the people who take care of those people who are most at risk, such as healthcare workers. We're just now at the beginning of the flu season, which means you can still benefit from a flu shot.
They still have a few weeks, the time enough to develop immunity before we'll really be in the peak of the season.
The flu season should peak by the end of February or the beginning of March. Dr. Burko says he has seen some flu patients this season and fewer children coming in for a flu shot. Little Massimo avoided the worst last year because his mother took him for his flu shot.
We had like the usual cold with the runny nose, but nothing severe.
And doctors remind you that one easy way to prevent the spread of colds and the flu is to wash your hands. Derek Conlon, CTV News.